What should you expect from your doctors and nurses going forward? Well, the first thing you should expect to see and receive is empathy. They should be empathizing with you. They should be telling you they're sorry this happened. They should be, other forms of empathy can be everything from, holding your hand when you're crying to giving you a hug to helping you with your immediate needs, such as, food, lodging, transportation, helping you get a counselor, a priest, or a rabbi, or whatever. That is all empathy. I want to be very clear that just because the doctor says they're sorry this happened and they're going to do a review, that does not mean they are admitting fault or apologizing. Admission of fault, apology would sound something like this. Well, I'm sorry we made these mistakes. It's our fault, and that's why your husband's dead. That's apology. Just because someone says they're sorry, that doesn't mean they're admitting fault. Think of the context of the words. I'm sorry this happened. I feel bad for you. We're going to do a review. That's empathy. Speaking of review, the next thing you should see or expect to hear from your doctors and nurses is that they are going to do a review. They're going to do an investigation to figure out what happened. And again, remember from the earlier video, they're going to try to determine if the standard of care was met or not. I need you to understand, a lot of patients and families, we all watch these shows like Law and Order, or ER, or any of these other medical legal dramas where each week in and week out you see very complex cases introduced to you, worked on and solved in 50 minutes or less. That's not the way real life works. When they do these reviews to try to determine if the standard of care was met or not, it may take a couple days, it may take a couple weeks, it may even take a month or two. These things can take time. One thing you should not look for or want to get or expect to hear from your doctors and nurses is what we call a premature apology or admission of fault. Sometimes doctors and nurses, they believe it or not, they can beat themselves up pretty good when something goes wrong, and they blame themselves, or they blame a team member, or they blame the team that, oh my God, we killed your mom, when in fact it was a known complication or a known risk. So don't look for that, and if you get it, be a little skeptical, because sometimes I hear patients and families who hear words like error and malpractice thrown around by a doctor or nurse, speaking off the cuff, and the review comes back and shows that there was no mistake. And the patient or family takes the case to a personal injury lawyer who says, yep, there was no mistake. And it just literally drives the patients and families crazy. So don't look for it. Treat it with a grain of, treat it with a little bit of skepticism if you hear it. Moreover, don't push for it. Don't push for it. Sometimes patients and families, they'll go out there fishing and saying, trying to push a nurse into an admission of fault. That's really not ethical. It's not fair, because that nurse or that doctor who's rounding is, to be fair to all sides, is in no position to tell you if a mistake happened or not. They're really not. They may have some hunches, they may have some guesses, they may have heard some chatter in the hall, they may have picked up some gossip in the coffee room, but none of that equates, in the law they call it hearsay, none of that equates to proving an error or not. So don't go there. So you want to hear empathy, you want to see empathy in action from the doctors and nurses, you want to see them and hear that they are going to do a review. Part of that review should be interviewing you as the patient or family. They should want to get your side of the story, because as a patient or family, you often will have a lot to share. You'll know a lot, because oftentimes, as healthcare gets busier and busier, and more doctors and nurses are involved in the care, especially in a hospital stay, you might have multiple doctors and nurses who are involved in your care, the care of your loved one. Sometimes the only one constant throughout that whole set of circumstances is you, the patient, the family. You saw it all happen and you've been writing it down in a journal. They should want to get your side of the story, because you may know things the doctor doesn't know, or you may know things the doctor doesn't want to be known. So make sure they get your side of the story. They should give you continual updates, and they should be date and time specific. Don't ever accept from a doctor or a nurse what we call a mush statement. Mrs. Jones, we'll get back to you. We're looking into it. Don't call us, we'll call you. We'll sit tight. We'll be in touch sometime next week. That is very mushy. It raises your anxiety level, and it's not fair to you, and it's not good for anybody, including the doctor and nurses. The doctors and nurses and you should be, it's like any type of business situation, there should be meeting times and dates. And the doctors and nurses should be date and time specific with you. At Sorry Works, we teach them to touch base with you at least once a week by phone, email, or in person, if not more. And every time you finish a meeting, you should set the time you're going to meet again. You need to stay in touch. And moreover, there should be an open door policy with your doctor, with the hospital, with the practice. You should feel free to call anytime you want, and they should give you that assurance as they give you their business card with their cell phone, pager number, and email. And when you contact them, if you leave a voicemail or an email, they should be contacting you right back. You should be looking for these things, and if you need any other types of support going forward, they should be providing that for you and your family. So those are the things you need to be looking for going forward.